Welcome to the VA BLUF. I am your host, former United States Marine Corps Staff Sergeant and fellow disabled veteran Jesus Flores. The BLUF is a military acronym for Bottom Line Up Front. The idea behind the VA BLUF is a simple one. We know you're busy, so we're cutting through all the noise and putting the important details about your healthcare first. The VA BLUF was created to bring you into the senior leader and subject matter expert fold at the largest VA healthcare system in the nation. The VA BLUF gives you access to the people providing your healthcare and that of over 184,000 veterans living in North Texas. Everyone listening to this podcast is either a veteran or knows a veteran. We know that veterans experience unique hardships that are exclusive to the veteran community. However, some don't know that VA employs people that can and will help them. It's why we're here. It's in our mission statement to care for those who shall have borne the battle and for their families and survivors. Today, we're talking suicide prevention with Mrs. Natalie Qualls, the current suicide prevention program manager for VA North Texas Healthcare System. Welcome, Mrs. Qualls.
Thank you for having me today.
There's the peanut gallery saying hello. I've been looking forward to having you on. I know I reached out to you a few days back. This is an important topic. It's an important topic for me because I've lost some Marines to suicide, and it affects a lot of veterans and their families. And even our secretary says this is is our highest priority. Correct?
Mm-hmm. Yes, he says it's our top clinical priority for the VA.
What is that? What does that mean?
Sure. Yeah, I have worked in suicide prevention for the VA probably around 5 or 6 years now. And, when I first started, suicide prevention was a much smaller program. We were kind of newly developing and figuring out our place in the VA. We knew it was a big issue, a big deal for veterans, but about a few years ago, the secretary really sat down and said, we really need to be attacking this hard, and we need to make sure that everybody in the VA, not just mental health providers or not just social workers or not just these little, groupings of people, but everybody in the VA needs to take on suicide prevention. And so he really kind of laid down that challenge for us. Suicide prevention is going to be a top clinical priority. We need to make sure that we're screening everybody when they're coming in for services and that everybody knows what resources we have available.
Prior to you joining VA, did you know it was this bad? Did you know that it was that high?
No, I have been with the VA for 10 years now, and my first job before that was in a substance abuse rehab facility, and that was actually the first place that I had encountered a suicide, and it was somebody who was in our program, and, I was flabbergasted. I didn't feel like I was prepared for how to handle it. I was freshly out of school, and we had talked about it briefly in school, but really didn't get into the nitty-gritty of what it's like to be a provider who maybe loses someone to suicide, and then how to respond to the other people in the program and how to support them after a suicide. So transition to coming into the VA, and it was the first time that I felt like people really were talking openly about it, and really was an opportunity for me to learn quite a bit more about it, and certainly that has grown just over the years of doing this.
Is talking openly about it, do you think that helps? I mean, I think in my opinion, it helped me talk about it with my sisters and with my wife, and I think, if maybe we could talk about those feelings and talk about, that insecurity that to the people, especially to the people that we trust, I think that would go a long way in helping us before we hit our breaking point. Now, I had to hit my breaking point before I started talking about it. I used VA last year. I found myself in just the hardest, I guess the lowest point of, my life to date, and I had nowhere else to go. So I walked into the ER and I was like, hey, I don't know what's happening to me. I don't know what's going on with me. And here I am on a podcast now openly saying this. So I think, do you think it helps?
Yeah. So first off, I'm really glad that you did make that step to come into the ER, because that is a huge, can be a huge barrier for someone to overcome. But yeah, I think that there has been a lot of stigma associated with suicide. I know just for me personally, even back in high school, we actually had a couple of kids in my high school who died by suicide, and it wasn't discussed. I think a lot of us knew the details behind how those kids died, but the school didn't talk to us about it. They didn't set up any type of support groups for us afterwards, anything like that. And so I think, my personal journey has been making sure that we are talking about it openly, because it's not a taboo subject. It's something that a lot of people struggle with, suicidal ideations, and the more that we talk about it, the more educated people will be and hopefully intervene. And also, when we keep it in the shadows and we don't talk about it, people who have lost loved ones to suicide, there can be some feelings of shame associated with that. And, that's not doing them any justice. It's not helping them in their recovery and helping them work through the after effects of losing someone. And so I think on both sides, it helps the people who are loss survivors, and it also helps people who are maybe struggling with that themselves.
Yeah, I hear you there. But while we're on your personal journey, let's lighten it up a little bit.
Okay.
How did you get into social work?
Sure. So I would love to tell you that it was a calling from being a child, but it really wasn't. I kind of stumbled into it.
Really?
Yes, I was going to Baylor and
you're a Baylor Bear.
I am Sikkim Bears.
Yeah.
I wasn't sure what I wanted to study, and I had a sister who had graduated from Baylor, and always kind of looked up to her, and she had gotten out of school, was having a tough time finding a job with her degree. And so I asked her, what would be something I can do that I know I'm going to get a job in when I get out of school? And she said, well, what do you like to do? And at that time, I had just finished tutoring a girl in mathematics, and I was really struck in my tutoring with her that she was incredibly brilliant. She knew math, and what was getting in the way of her succeeding was her home life. She didn't have much support at home. She would go to school without food for the day, and so I was telling my sister about that, and she said, I think you need to check into social work as a place where you can kind of go and help people in their darker spots and help, kids in their homes or whatever have you. And so I stumbled into it. I did a couple of internships while I was at Baylor, and the first one that I really felt like clicked for me was I was at a domestic violence shelter, and I was leading some group processing with some of the participants or the residents at the shelter. And I got out of my first group, and I just felt like I could do this. And I could see myself doing that. And so that was really the first time that I thought, okay, I'm going to stick with this and see it through. And I'm certainly glad that I did, because now that I've been in it for a while, it's just such a broad profession, and there's so many different ways that you can help out and so many different things that you can do, and it's certainly been a big impact on my life.
And between then and now that you are the suicide prevention program manager, you had a couple of stops on the way. So how did you walk me through that, and how you ended up at VA and why you ended up at VA?
Yeah, so like I said, my first job was at the substance abuse treatment facility, and they hired 5 of us right out of Baylor. So it was a group of us who started at that facility together, and one of the girls had interned with the VA, and she said, I can't wait to get back to work for the VA. And she would just talk all the time about how much support there was for the veterans, how much support there was for social workers there, how she felt like you could grow and you could learn. And she she maybe lasted 6 months in that first job with us until she got back into the VA. And, that just stuck with me. I wondered, what is so special about the VA? And so when a position came open for addiction therapist, I put in for it and decided to go for it. And I'm so glad I did. I just, I've done a couple of different things throughout the VA. Started out in Waco, did the addiction therapy position for a while, moved into suicide prevention at the Waco VA, and I loved it. I mean, it was challenging. It was unique. I felt like I was making a difference, and I really didn't want to leave it. But life happened. My husband got a job up in Dallas, and for us, Dallas was the big city. We really didn't want to move out of Waco. But, sometimes you got to make those tough decisions. And so moved to the Dallas VA, worked real briefly in the Healthcare for Homeless Veterans program, which was very eye-opening. I mean, first off, moving to a big city where, I had never encountered, homeless encampments. And I had never worked with homeless veterans. And just to be able to go into those environments and really kind of see what some of those veterans were facing and trying to help them from the ground up, starting with, okay, let's get you into some sort of stable housing. And let's, for some of the veterans, it was the first step was, let's get you your documentation. Let's get your IDs in order, that kind of thing. And it really also helped me learn the Dallas VA because I had to, if I was working with a homeless veteran, had to know the housing programs, I had to know the mental health programs, had to know about primary care, specialty care, and it was really a great introduction into the system. But I always missed suicide prevention. There was a part of me that just felt connected to that program. And so when an opportunity came open to put in for the program manager position, it was just, there was no hesitation to put in for it. And so I was lucky and ended up getting the position. And so that's how I ended up where I am now.
So do you know now why that person thought VA was so special?
Oh, yes. And actually, she is still a VA employee as well. Really? Yeah.
Do you keep in contact with her?
I haven't as much because she's still down in Waco. Okay. But every now and then she'll reach out to me for something that's, if she needs something up in the Dallas area. And so I know that she's still there. But yeah, like I said earlier, the VA really helped me see how broad of an impact that social workers could have. We have social work embedded within our mental health programs. They're embedded in the emergency department and our primary care and some of our specialty clinics. And it's really a place where you can really do collaborative care for your clients and for your veterans. When I was working at the substance abuse treatment facility, if I had a client that needed housing, needed health care, needed mental health services, that was 3 different referrals I was having to send out for that client. Within the VA, we have all that embedded within our system. And so, it's such a comprehensive care that we can provide that I just feel so supported in it, and I feel like I can do good work for the veterans I'm trying to help.
So it's like a one-stop shop, huh?
Yes, very much so.
So you transition into this role of suicide prevention program manager. What exactly is the suicide prevention program manager?
Sure. So this would be the time that I would love to kind of introduce you to my team. I actually have 6 social workers who work in the program. And so a lot of what they do is we kind of have a couple different boxes or sections of our program. So kind of initially we are focused on education, training, and outreach. So we train all new VA employees on suicide prevention when they come in, how to handle a crisis caller, how to handle a suicidal veteran, and also as we know, a lot of encounters with people who are suicidal they're not going to be restricted to just being in the workplace. So what to do when you're at home or at church, and you in your community you may run into this. And then we also go and train in the community as well, because a large number of our veterans that we lose to suicide are not coming into the VA for health care. And so making sure that those community partners know what resources are available and know how to intervene with somebody who may be suicidal. And then we have a clinical piece to our program, which looks like kind of doing the follow-up on the Veterans Crisis Line. So when someone calls the Veterans Crisis Line, they get a national hotline responder, because they're staffed 24/7, and that responder will talk to them and safety plan with them, make sure that they are going to be safe until we can get some local follow-up for them. And so they will work with them and then offer them a referral to our local suicide prevention team, and that's where we come into play. So we get those referrals and we follow up with those veterans, and it could be anything for the crisis line. I mean, it can be helping that person who's never come into the VA for care to help them get enrolled and established. It could be maybe someone who has lost their medication and working with the pharmacy to get that medication sent back out to them, all the way up to, someone who feels like they can't stay safe. And so talking to them about how to maintain safety and getting somebody out there to, hopefully intervene and bring them in to ensure that they're getting the care that they need.
When you talk community outreach, like you guys are actively going out into the community, is that?
Yeah, so it's...
I know kind of with the pandemic, it's not, maybe as
right
high tempo as it used to be, but you were actually going into that's exciting.
Yes.
I did not know that.
It's been a little bit different recently. So we were going to some of the local coalition meetings, and we've done a couple of larger events. Last year we did the U.S. Army Field Band came and did a concert that we sponsored, and so we brought in, I think we had 600 people in attendance to the concert, and so beforehand we had the opportunity to have our director go up there and talk about suicide prevention to a larger audience. We've done some stuff like we've done some advertising of the crisis line on a local radio station, and then this past year we advertised the crisis line on some of our public transports or public transit in Dallas.
I've seen those on the DART buses. Yes.
That was us. Yep.
Wow.
Yeah. So, we had to get creative this year and how we were going to reach out to people. And we partner with a few kind of big suicide prevention stakeholders in the area. So just trying to attend some meetings that are still going on virtually, and partnering with some of our key stakeholders in some of the events that they were doing. And we've been able to still do some trainings and outreaches just through different ways than what they looked like 7 or 8 months ago.
So let's do some rapid fire questions for you here. We know suicide affects people, or affects a lot of people, but does it affect certain groups or ethnicities more than others? Yeah.
So there are some different prevalence rates through different groups and ethnicities. So by just raw data, our Vietnam-era veterans are at higher risk. Now, we have seen an increase in rates for our OEF, OIF, O&D veterans, but still the male population still is at a higher risk than the females. Even though our female veterans are at higher risk than civilian females.
Really?
Yes, yeah. And so, we could sit and kind of talk about different groups that are at higher risk, but I think one of the things to kind of remember is it's good to know those things, but suicide impacts everybody. I have seen, all different ethnicities, all different ages, socioeconomic statuses, married, not married. I've kind of seen it all. And so it's important not to kind of pigeonhole it into specific boxes.
So it doesn't discriminate at all, huh?
Correct. Yeah, it is across the board.
How do you reach women veterans and minorities in the LGBT community with your program?
Sure.
Since those, I know for a fact women veterans is our highest growing population in VA, so I imagine reaching them is important for you too.
Yeah. So VA has staff members specific to women's health and specific to LGBTQ plus populations who really have partnered with us on some efforts to reach out to them. So for women's health, recently one of the things that we did was we ensured that we got suicide prevention posters and handouts and resources into the clinics that serve our women veterans. We have our LGBTQ plus coordinator who works alongside us on outreach efforts. So in the past, they've pre-COVID gotten creative, and they marched in the Dallas Pride Parade, and they have come up with some really kind of great branding on some items to give out to ensure that people know that, we are an inclusive healthcare system. And so they'll every now and then kind of set up tables around the different campuses that the North Texas VA has and hand those out to people. And so it's a lot of kind of collaborating with those people to ensure that we are reaching those groups.
You kind of mentioned this earlier in the podcast, but I want to clear this up. Can anybody just out of the blue? I know you said most of the veterans who are committing suicide don't use VA, but if one of them is feeling like, hey, I'm down and out and I've hit that point, can any of them just come in and request help? Or
Yeah. So VA has a very open door policy for that. Certainly right now we have a couple of, because of COVID, kind of things that we ask people to, maybe call in advance or maybe call the Veterans Crisis Line. But I don't want that to prevent anybody from, if they need to walk in and see somebody, you can certainly still walk in and see. I mean, we are on campus. We have staff in their offices who are working in safe ways to engage with those veterans. So certainly, come in and seek assistance if you need it. I mean, the VA will work alongside you to, go through the enrollment process and figure out all that paperwork. And actually, veterans can apply for healthcare benefits online as well. So they can go in and do that if they want to do that before walking in and seeing us. But if you come in to see us, the VA will work with you to kind of get things set up for you.
Does somebody have to be service connected to come in and seek help?
No, you don't have to be service connected to seek help. The VA has lots of different programs, and they can help you down the line kind of figure out the service connection piece, and don't want that concern to prevent anybody from coming in.
So you would encourage people to just, hey, if you're feeling it, come on down.
Correct.
While we're there, self-help, deep. I don't know if de-escalation is the right one. I think that's more for use of force. But I guess de-escalation. What can you talk about that? Can you tell me how?
Sure.
My wife always says, breathe.
Yeah.
Right? Is that?
Yeah. So there are a lot of different kind of techniques out there, and I think you have to figure out what works for you, but there's so many resources out there to kind of help you figure that out. So some of the things that I would recommend, we actually have some great apps. We have the Ptsd Coach app. Which
you stole my question. Okay, let's talk about the Ptsd Coach.
Yeah. Well, we also have the COVID
app. The COVID app. That one.
COVID Coach.
We've been promoting that one on our social media.
Yeah.
So.
And we have one called the My3, which is a safety planning app as well. And so actually whenever COVID hit, I downloaded the COVID Coach app because it was, a very stressful time, and I really needed to be doing kind of some self-care, and the app really kind of provides you some different things to try, and you can mark which things you like and which things you didn't like. And they were for, as simple as, go and take a walk to, maybe writing some stuff down. I mean, just very hands-on and practical things that you could do.
What advice would you give someone who is unsure or just, I feel embarrassed to come in and ask for help?
Yeah. I will say that, a couple of things. So first off, just know that mental health is just health in general. It is part of your well-being, and the brain is a very complex thing, and there's actually, there's actually kind of physical things that could be going on in your brain, and you may not have control over that, and that is completely okay. So just know that, your mental health is just general physical health. The other thing that I would say is that you are coming into a place where people want to help veterans, and people are trained and seasoned to help veterans. And so mental health services definitely, you have a lot of people who have hung around because they find a connection to helping veterans, and they want to be there to support them. So, and I would also say you probably don't realize the number of people who are actually seeking mental health services.
Yeah. When I went, I didn't, the first thing he told me was like, you're not important enough to be the only one.
Yeah.
I was like, thanks, and he goes, first off, thanks for coming in. So I thought that was really cool. Because he helped me de-escalate that situation. I thought there was no way out, right? But maybe all I needed to do was just hear it from somebody else.
Yeah.
Can you talk to me about some of the advances and the benefits of using the telemental health during this whole thing? I know you kind of touched on the app a little bit, but
Yes.
You guys are also doing appointments through the telemental health and using the camera on the front of the phone and all that
Correct.
good stuff.
Yeah. So
I feel like my mom talking about it.
So we've had telemental health before COVID hit, but I think with the pandemic, it's really allowed that program to grow and to shine quite a bit. So we do offer the telemental health, which means that you don't have to come into the clinic to see someone face to face. You can do it from the comfort of your home, see a mental health provider. And they're even coming up with that program is kind of constantly developing and changing based on what needs they've seen. So recently, one of the things that they're moving towards is actually setting up some telemental health kiosks or places that you could go and do it. So say you maybe live with somebody and you wouldn't want them to kind of be around while you're doing your telemental health. And it can be hard to find privacy or something like that. They're actually working to set up like a couple of local VFWs to have a room that you could go into and actually have your telemental health within the VFW and connecting to your VA provider.
Wow, that is exciting. That is very cool.
Yeah.
All these efforts, all this, money that VA is putting into it, are you seeing a change?
So what I have seen is there's definitely been a cultural shift. I see when I first started, people kind of saw suicide prevention as just being like a mental health issue. And what we know is a large number of vets that we lose to suicide never even came and saw mental health. They were seeing their primary care, or they weren't coming into the VA at all. And I think the VA has finally shifted to where people realize I need to be thinking about this. The primary care providers, I need to be thinking about this when this vet comes in to see me. And the specialty clinics, they're screening now for suicide risk as well. And just in the last couple of years, I have seen that people in different parts of the hospital really want to figure out what they can do to make a difference. And so certainly I think the more that we have people talking about it, we will start to see some change.
Because it's no longer just a mental health thing. Like
Right.
our whole entire system, like we talk about it in public affairs. We talk about it, in primary care. It's the whole team coming together, huh?
Correct.
And that is exciting. So right as we're getting here, I'm getting ready to wrap up. My last question for you is, what do you think we need to keep doing to increase trust in VA?
To increase trust in VA. So I would say one thing that we could keep doing is just to kind of be present with our veterans, hear what their needs are as we are constantly growing and evolving, keeping the veteran, in the center of that and allowing them to give us feedback on what's working and what's not working. And I mean, VA is big, we're a huge healthcare organization. And so allowing the vet to kind of drive what changes for our system, I think, is a way that we can help increase and enhance that trust. And always being present, always with the crisis line, always picking up that phone call with our staff who are in the office, always being there for the vets and being ready and willing to listen and to help out.
That's a really good answer. I like that. Yeah, thank you. I normally ask people, there at the end, because I want to hear these ideas. I think it's important for people to know that we always want to progress. So thank you so much. Thank you for coming on. I hope we can do this again down the line. But it's time for me to wrap up. So that's all the time we have this week. I want to thank Mrs. Qualls for coming on today. Thank you guys for tuning us in and leaving us on. We encourage you to tell your friends and family about the VA BLUF. You can follow the VA BLUF on social media by searching for the VA BLUF. That's THEVABLUF on Facebook, Instagram, Twitter, and YouTube. You can also catch this and all episodes of the VA BLUF on buzzsprout.com or wherever you get your podcasts by searching for the VA BLUF. Thank you to singer and songwriter and friend of the show, Cole Reisner, for letting us use his music. Remember, Bluffers, at the VA BLUF, we are putting the important details about your healthcare first. Until next time, and for everyone that's made this one possible, I'm Jesus Flores.